All right. Hello, everybody. Thank you so much for joining today. We will just take a minute, let everybody join us. We have a very big group joining today, and I'm very excited to hear from you guys. I am Emma Valinsky-Lloyd. I'm the Director of Policy and Programs for the Executives for Health Innovation.
And I'm Jen Kovich-Bordnick. I'm the CEO of EHI and delighted to be here today.
Yes, I'm really excited for this topic. I can't say it's new to the industry by any means, but it is new to me, and it's exciting, and I'm really glad that we're going to be able to have such fantastic speakers talk about it today.
You know what though, Emma? It'd be cool to know where everybody's logging in from.
Absolutely. Jen, where are you logging in from?
I'm logging in from outside of Washington, D.C. in beautiful Maryland. How about you, Emma?
I'm in Arlington, Virginia. How about you, Olesya?
Hi everyone, I'm logging in from Europe. Right now I'm in London, usually I'm based in the Netherlands. Yeah.
Okay, you win as the coolest place to be logging in from. Ankoor, how about you?
Atlanta, Georgia.
All right. And folks online, if you want to just put in the chat box where you are, in the comment box where you are logging in from, that would be great. We would love to know where you're logging in from.
So, oh, here we go. Actually, we just made it so attendees can chat with everyone.
Perfect.
We just fixed that. Also, I always like to add, if there's anybody from New Hampshire that's joining, I love to see it. I grew up on the seacoast, and so I just have to wave to everybody in New Hampshire. So you have to put it in there if you're from there. But I guess.
All right. And then let's just hear real quickly from Joe and Seema where you guys are logging in from.
Yeah, hi everybody. I'm actually in Maryland today. I'm usually in Boston, but today I'm in Maryland, just outside of DC.
Awesome.
Great place.
Well, looks like we have a strong presence from the nation's capital. I'm logging in from DC today as well.
Wonderful, Seema. Great. Well, Ankoor is going to introduce our prestigious speakers in just a moment, and Emma's going to get us started with some introductions. So yeah. Emma, I'm going to turn it over to you.
Yeah, so I'm hoping many of you have been to our webinars before, but if you haven't, we are the Executives for Health Innovation. Bianca, could you go on the next slide really quick? Yeah, so we are a nonprofit based out of Washington, D.C. We are a convener of experts and executives from across the entire healthcare industry. I think what makes EHI so great is that we are able to bring voices from every section of an issue. And when you bring those together, you're able to find, more thoughtful, real solutions. And so that's what we are. And that's why we have this webinar today. Next slide. So we are a convener. So we do collaborative learning like roundtables, work groups, task force. We help shape policy through educating policymakers in their offices. And we help build a network of like-minded thought leaders. But we also have been at this for a while. Bianca, if you want to just go to the next slide, so you can see everything we've been doing. I really just want to point out that we are a group that wants to get people involved. You can see that we have been through all the different health IT issue areas, and we continue to work on the most current, most pressing issues today. So you can see we've done e-prescribing, value-based care, digital health innovation, and supporting patient experience. So next slide. And I think honestly, we do patient experience. We've been working on patient experience since the beginning, but along with that, we're working on health equity and access, privacy and cybersecurity, and digital care. And I say that these are our focus areas, but we really do work on all different types of issues, not just those. But also, we are a multi-stakeholder group. So if you can go to the next one. So you can see, just like I was saying, we have a vast and a wide variety of members as well. If you see your name up there, know that you, and not just your company, is a member of EHI, and so we would love to get you involved. If you don't see your company name up there, but would like to see your company name up there, we would love to have you. And if you would like to get involved, you can just send me a message in the chat. next, I just want to quickly remind everybody that as an educator, we do have quite a lot of research and reports. We do a lot, you can see here how many we've done recently with our members, but we also have a resource center that I'd like to direct you to, and I will put in the chat in a second, that will bring you to not only the resources and reports that we have, but also all of the webinar recordings and slides that you will have from today. You can find those as well in the resource center. All right, and then we have upcoming events. As the summer has come to a close, EHI is really starting to ramp back up. So these are just the ones that are happening this week. We have quite a lot coming up. We have our policy briefing with Dr. John Halamka from Mayo Clinic Platform. He will be doing our September policy briefing. Know that EHI does policy briefings every single month, so look forward to October and November. And then on Thursday, we have Defining Your Organization's Path and Analytics with one of our members, Milliman. So if you want to register for those events, you can go to our website. You'll have events and you can join us there. And lastly, of course, a big thank you to Accentur, one of our members. Without our members being so supportive, we wouldn't be able to do such great work with such great speakers. And so before I hand it over to Ankoor, could you go to that slide? Yeah. Before I hand it over, I just want to remind everybody how lucky we are to have Ankoor here today to moderate our discussion. Not only is he a provider with a whole lot of knowledge and experience, he's also incredibly passionate about this work, and you can really see it in the stuff that he does with his team at Accentur, and I think you'll obviously hear it today in the discussion. So with that, I will hand it over to you, Ankoor.
Thank you so much, Emma and EHI, and hello to everyone out there in the virtual world. My name is Ankoor Shah. I lead our health equity practice at Accentur, and I'm a pediatrician still practicing as well. We have an incredible panel today. I want to introduce you to Joe McCannon, who is the healthcare leader and senior advisor in the Office of Climate Change and Health Equity at HHS. Seema Wadhwa, who's the executive director of environmental stewardship for Kaiser Permanente, and Olesya Struk, who's a group sustainability senior director globally at Philips. So we have an incredibly passionate and knowledgeable group that I'm looking forward to having a great discussion and really hearing from you all in the audience as well. So let me just take a step back and talk about why we're here. I think as many of you in the audience, as our panelists and myself, we've been hearing a heightened interest in understanding what our healthcare organization stakeholders are interested in ensuring their company does. By stakeholders, we're not only talking about shareholders anymore. We're talking about your patients, your workforce, and your community. And what is your organization doing to advance justice for its people and planet? And through Accentur research for, let's say, the topic of health equity, we know 9 out of 10 healthcare leaders say it's a top priority for them. That number drops down to about 35% when we ask if there's a plan in place or a budget to actually actualize that priority. So there's a gap. And how do you get started? How do we make it long lasting? How do we tie it to business value? I think these are the questions that all of us are hearing, and this is a conversation where we hope to get some of those thoughts and answers as well. So before I pass it over to panelists, I just wanted to make sure we all are on the same page when we talk about health equity, what that means. So really briefly, health equity as a definition is essentially the opportunity for every single person to meet their health potential, health and life outcome potential. But inherent in that is the acknowledgement that there are historic and structural barriers that create communities that have unequal access and opportunity and have unequal outcomes. And the acknowledgement that there's something just generally unjust about unequal outcomes. So for example, there is something unjust that rural Americans have higher likelihood to die from heart disease and cancer than urban Americans. There is something unjust that Black women have a 3 times more higher likelihood to die during pregnancy than white women. So in order to advance justice, we can't take an equal intervention approach. We can't just have the same thing for everyone because that will continue to have unequal outcomes. So an equitable way is through differentiation, personalization of the intervention. So you actually you start narrowing that disparity and have equal outcomes as well. And now in this conversation, it's really, well, how does health equity really tie into environmental sustainability, into climate change, into health systems role in that? And that's actually what I would love to start our conversation with. So Seema, why don't we start with you? For all of our panelists, I think the audience would love to learn a little bit more about you and what you do. And then I would love your perspective on the intersectionality between sustainability and health equity.
Great, thank you so much. Thank you, THI, for hosting this and for putting together such a great panel. So to share a little bit about myself, I'm the Executive Director of Environmental Stewardship for Kaiser Permanente. And to fold that out a little bit, to explain what that means, I act as a hub for the organization when it comes to our sustainable operations. Hospitals in the healthcare industry provide a significant portion of greenhouse gases and carbon into the world, and we account for between 8 to 10% of greenhouse gases for the healthcare industry. So really looking at what we're doing to reduce our own impact. Secondly, I am focused on our strategy to make investments in the community related to community health through that lens of environmental stewardship. What are the things that we can make investments in through our community health and community benefit work to improve on the upstream side, the health of our communities? And then lastly, how are we catalyzing change through leading and engaging through coalitions, policy and advocacy, and stakeholder engagement? And so, the way I come at this work is, I started my career and I trained as a civil engineer. And when I look at what can we do to make, I started with building communities and roads. Now I'm really focused on how can we actually improve the health of those communities we're serving. And, oftentimes people, when they think about climate change, their first image goes to polar bears. Not enough people are making the connection that climate change is impacting health. And unfortunately, it's impacting the health disproportionately of communities that have already been socially disadvantaged and discriminated against. So, that's the lens in which we are looking to take action and thinking through the solutions and support we can provide. Thanks.
Thank you, Seema. Same question to you, Joe. I think we'd love to learn a little bit more about yourself and your perspective on sustainability and health equity.
Thanks, Ankoor, and thank you to EHI, and thank you to the other panelists. It's really, when I think of cutting edge thinking in the space, I think of KP and I think of Phillips, and so and Accentur. So it's a pleasure to be a part of this conversation. As was mentioned earlier, I'm the healthcare sector lead at the Department of Health and Human Services' new Office of Climate Change and Health Equity. So my background is actually in large-scale systems improvement or scaling. So essentially, how do we take evidence-based solutions and bring them to everyone who could benefit from them? And I started doing this kind of work as part of something called the 3x5 initiative with the World Health Organization, which was an attempt to get 3 million people onto antiretrovirals for HIV and AIDS by the end of 2005. I did similar work on patient safety. I directed something called the 100,000 Lives campaign for the Institute for Healthcare Improvement, which focused on getting U.S. hospitals to reduce infection and medication, surgical complication. And then I was in the Obama administration working on rolling out the Affordable Care Act, spreading new models of payment and care delivery. And about 5 years ago, I began to work with some organizations that were trying to figure out how to spread best practice on climate change and health equity And I felt that this was, probably the most important area out there that sort of existed at the confluence of my skills and interests. And so, yeah, I joined this office a little over a year ago. And the office's overall remit is to protect the health of Americans from threats presented by climate change. And the specific part of that work that I'm involved with is our work with healthcare facilities and healthcare institutions. How do we help them both become more ready for the impacts of climate change, especially on the most vulnerable communities, and how do we help them take a leadership role in reducing their emissions? I think Seema has answered the question really well when it comes to the relationship between sustainability and equity. I think when we think about the origins of the fact that vulnerable populations are impacted disproportionately by climate change, this is something that we see kind of with most major public health challenges in the U.S. As we have with the pandemic. And at the root of that is discrimination, disenfranchisement, underinvestment in communities that's happened over decades. And so when climate crises hit, that means they're less resilient and at a huge disadvantage. And I think what we've seen in Jackson, Mississippi in the last month is kind of a case in point there, where you have chronic underinvestment in a community's infrastructure combined with a climate crisis, and that leads to a health crisis of major proportions and lots of suffering. So, I think, in places where climate change is really persistent, or where the manifestations of it are really persistent, if we think of storms, wildfires, extreme heat, it exacerbates social determinants of health, and housing insecurity, transportation challenges, access to education and economic opportunity. But I think increasingly we start to view it as a social determinant of health in and of itself. If you're in an area that's constantly being hammered by climate-related impacts, it is a social determinant of your health. And so, people who are living on the Gulf Coast now experience that. The people living in wildfire areas experience that. So that, I think, is kind of a critical perspective to take on this as well.
Definitely. Thanks so much, Joe. And then I'll pass over to Olesya. Tell us a little bit more about yourself and what you do, and then any thoughts you have, I guess, expanding on what Seema and Joe were talking about.
Sure, thank you, Ankoor, and thank you very much, EHI, for organizing such an event, such a discussion on this important topic, and my pleasure to contribute to it. So my name is Olesya Struk. I'm working for Philips Health Tech Company, where we provide technology, software, and services along the health continuum. And my role is sustainability business partner to geographies, to markets like North America, and leading one of the programs, which is Access to Care, as contributing also to improving healthcare outcomes, especially in the disadvantaged communities. So in Philips, we are quite committed to environmental, social, and governance framework. So on an environmental side, we already reached the carbon neutrality in our operations 2 years ago. And also in our market in the United States, our team in government affairs, public affairs, in the research, innovation, in services are working closely across the stakeholders on the environmental and also social contribution. Therefore, as Seema and Joe already very nicely outlined, the connection between environmental factors, between the climate change and also how it impacts disadvantaged communities and on the root causes, I would like actually to look into health system and healthcare industry, because healthcare industry is one of the largest emitters of the carbon footprint. It's about 4.6%. It's more than aviation or shipment industry. While on the global scale, around half of the global population lacks access to basic healthcare services. right? So therefore, some things gotta change there. And we believe, for example, that digital technology is one of the key enablers to extend access to healthcare while reducing its environmental footprint. Maybe also on the practical matter, so we believe that partnership is absolutely essential for it. And we, for example, partnered with the World Economic Forum to design the principles for a resilient healthcare system that includes also technology and service delivery, reimagine healthcare around the patients, but also the governance around it, healthcare workforce support, data innovation towards a digital architecture of care that we believe is an enabler, and also making healthcare financially resilient through the financing systems. And therefore, we are open to partner to collaborate about the carbon footprint reduction in healthcare, and also extending the services to a bigger reach of patients. Thank you.
Thank you. I love the that juxtaposition of healthcare industries are have a large carbon footprint, and also globally, we're not doing a good job of having access to care. Is there a way how can we solve both? And then tying on what Seema was talking about making those community partnerships to get it done. What's the role of technology? And then how do you factor that in, understanding these are non-medical drivers of health that Joe mentioned as well. I wonder, Joe, if you could give us a perspective. I mean, you have such an interesting purview within the federal government. If there is kind of what is the office thinking about or working on right now that is both on the incentivizing, enabling healthcare delivery systems, for example, to advance their sustainability agenda, environmental sustainability agenda, and health equity agenda, and then a little bit about what is coming in the future, and your thoughts on enabling incentives versus a regulatory lever as well that might be in the works.
Sure, yeah, happy to discuss that. And I think, to start, I think this administration and HHS and our office we're mobilizing healthcare institutions and other healthcare stakeholders to focus on climate change and health equity through our own aims and commitments. So we're basically saying that, or trying to say, this is what success looks like, this is where we need to get as a sector, and seeking to gain some industry-wide consensus on that, so that we're all crystal clear on what success looks like for all of us. So that starts with the Biden administration commitments made on Earth Day 2021 to reduce emissions 50% by 2030 and get to net zero by 2050. And then it includes Executive Order 14057, which came out last December and obligates all federal facilities, including federal healthcare providers, so the VA, Department of Defense, Indian Health Service, to meet those same goals, those same emission reduction goals. And it also includes the commitments we made at HHS last year to joining the health program at the UN Climate Conference, to developing a low carbon and resilient health system. It involves this explicit strategy we created at HHS for the first time, which focuses on environmental health and climate health. And then, what we did last spring on Earth Day is we announced this thing, the White House HHS Healthcare Sector Climate Pledge, where we invited private sector stakeholders to share those commitments. So 61 organizations, including Philips and KP, and groups representing providers, who themselves represented more than 650 hospitals, suppliers, pharma, GPOs, insurers, others, they all signed on, and more are actually signing on now since we've reopened this pledge through October 28th, if anyone on the line is interested. So that's kind of the aim setting piece of it. In terms of how we help the sector achieve those commitments, which I think is what your question is really getting at, In our first year, we've been mainly focusing on supports and incentives. So we introduced a webinar series on kind of the financial or financing opportunities that are already available. We introduced last week a toolkit from AHRQ on organizational approaches to decarbonization and decarbonization measures. We're about to launch a collaborative on the relationship between climate change and cardiovascular disease in November. And then, most recently and most significantly, you have the Inflation Reduction Act bill, this, massive investment in combating the impacts of climate change. And while we're still digesting it, it's pretty clear that there's a lot in there that's going to be of relevance to facilities and communities to help fund their sustainability work. I will say, Secretary Becerra, when he launched our office, said that we're going to use every lever at our disposal to try to stimulate and support change in the country. And so that is a nice way of saying we are exploring regulatory options with the agencies within HHS, and we feel responsible to do that. But again, we're focusing first and foremost on helping organizations kind of find ways to start and find ways to finance their investments in this work so that they can get the leadership commitment they require and do the initial work they need to do to build internal momentum. One last note I'll share is that every agency within HHS is currently developing its own kind of detailed strategy on climate change and equity. So I think that each is thinking about kind of the combination of incentives, programmatic supports, regulations, other levers that are available. So, there should be much more to come in the next year.
Thanks so much, Joe. So what I'm hearing is that your office is not only providing technical assistance, there's going to be, if not already soon, financial support. But from the business perspective, it's not only the right thing to do for the people on planet, but there's a future we could envision in that it's a must to do as well to be a good steward within the system, within our healthcare ecosystem as well. So we're seeing that kind of perspective from the federal government. Seema, I love that your experiences doing this work within large healthcare delivery systems, and I would love to hear your perspective on other value streams for the organization that as you're pursuing your environmental sustainability agenda and health equity lens to work outside of just it's the right thing to do for your people and the planet, are there other value streams that the delivery system and the business is thinking about and should be thinking about?
It's a great question. So, I think that there has been this preconceived notion that making environmentally sustainable choices and thinking about environmental stewardship always cost more. And, I think what we can say is that we've seen evidence to the contrary. Specifically thinking about our energy and our electricity, we were very early adopters when it came to renewable energy. Right now, all of our electricity is sourced from renewable sources, whether that's wind farms or through utility scale solar farms. And, that was an investment we made many, many years ago now. But the reason I say that is if you look back over this last year and you have all of this energy pricing volatility that came from the geopolitical disruption, war in Ukraine, that gave us the opportunity to be insulated from that and realize cost savings through that. And, while that was a choice that was made previously, looking at where we are now and leveraging some of the great funding opportunities that are available through the IRA, geared towards healthcare institutions, nonprofits, which typically has not been the case, there are opportunities to really change the dynamic of how the financial dynamic of environmental stewardship and sustainability. And, I think in the same way that Joe mentioned, this really is an all of government opportunity to act. It's an all of institution for healthcare, for individual healthcare organizations, but also an all of healthcare requirement to drive change, right? So if you think about supply and demand, if we're able to create enough demand for products that are environmentally preferable, that cause less harm, you know, if we leverage the force of the healthcare economy, it's about 18% of the GDP. That really has the opportunity to shift markets.
Thank you. That's a great perspective. You know, Olesya, I would love for you to help widen our aperture. You know, I've been focused on healthcare delivery systems in the US. Let's take a global perspective and let's think about the whole healthcare ecosystem, especially non-traditional players in the healthcare ecosystem. Why are these companies getting into healthcare, and why are they trying to address, or why is Philips really trying to address that intersectionality between environmental sustainability and health equity?
Sure, thanks for a great question. So first of all, I still would like to acknowledge that we applaud the Kaiser Permanente effort to move to renewable energy, and that's also a great example of resilient and sustainable move. And really appreciate our participation in the HHS Climate Pledge that we are able to support it, because it takes really movement and the collaboration across the value chain. So in Philips, ESG is we embedded ESG in across the value chain, and specifically it starts also with the company purpose to improve health and well-being of 2 billion people lives by 2025, including 300 million people in the underserved community. And that sense of purpose also helps to, of course, to make the company strategy a little bit more strong and more outspoken. And also striving for health equity in such a way is embedded from the very beginning. And also part of company's purpose is to cater towards our planet and the wider range of the stakeholders in our work. Why this is the good approach? It's a transformational actually efforts. So environmental efforts and health equity efforts are transformationals. Therefore, embedding them across with the help of embedding them in the vision, then setting the KPIs. So we are setting KPIs in our entities in Philips on those efforts. And also our CEO is leading that, and we are working with our teams, and we are also building a lot of awareness of our employees, of 78,000 employees, building awareness, education, engagement around the topic is very powerful. For example, engagement on the topic of access to care and the striving for health equity is one of the strongest among our ESG programs. Also, what is important is the collaboration research. Research collaboration that results in more data, proof points, and facts to build the future business cases. For example, we are looking into the needs and requirements of underserved communities in the United States and how to include them early in the innovation process. And also have an ESG framework now on the supporting environment and the stakeholders. We see the increasing interest of investors. That's also what Seema referred to. Also customers and large healthcare delivery systems, also private offices are asking us to help within our scope to improve their carbon footprint and sustainability. Consumers are very outspoken, since we have also personal health consumer facing division, and also patients' voice is becoming more prominent about environmental part and especially about the health equity. So, but last but not least, but employees are, it starts with them and building on the employees' movement and employees' ideas. As an example, Philips designers sparked an initiative in the quest for more inclusive design for health equity in our design lab in the United States. So I hope it gives some color. Maybe one more item is also example partnerships that we are collaborating, for example, with an NGO, with a matcher, a not-for-profit humanitarian aid organization dedicated to improving the quality of life of people, communities, and planet by sourcing and directly delivering surplus medical supplies and equipment to communities in need around the world. For example, this past year, Metro delivered much needed ultrasound from Philips to Access Community Health, a safety net clinic in the Bay Area. I hope that gives a little bit more.
That's that's a nice segue, because you mentioned inclusive design, research, KPIs, and it goes into really the how. So we've discussed a lot around the why from the federal government point of view, from the importance to people and the planet, to even important financial levers that show the why. But as I talked about a little bit around Accentur research, there's a real gap between, yes, I want to pursue this agenda versus actualizing it. There's that gap. So where do you start? And how would you advise a lot of our organizations who are aligned with the mission, with the stakeholders, but then you're a little overwhelmed? It's a big topic. What's the first step? How do you align yourself? Maybe toss over to you, Seema, to say, like, how would you phrase it, and then invite others for discussion.
It's a great question, and yes, it can be overwhelming. And I think one of the most important things to realize as you start your journey is that you're not alone in this, and there are other organizations that are in different places in their journey, as well as a variety of tools and resources available, including the ones that the Office of Climate Change and Health Equity are developing and sharing. So the first thing I would do is really scan for what are the coalitions and resources that are available. And, I know that some of them have been coming up in this. I would also say another important element is understanding two things. One, are you engaging the leadership within your organization to really drive this? Because that is going to be the most effective way to make a change as quickly as a change is needed. And then the second thing is to be thoughtful about talking about this in a multilingual way. And what I mean by that is that climate change and health equity and addressing this work, there are a lot of different root reasons to do this work and to be engaged. And understanding who it is you're speaking with and connecting the why to them really can make things move quickly. So, I think breaking it down to making sure you have the driving force by leveraging the right whys, and then connecting with the right leaders to make that happen. And then lastly, connecting to the resources that already exist so that you realize there is already a strong movement around this work. And you're not starting and trying to figure out from scratch.
Is that how you think about it as well, Joe? Because your experience, especially launching, I remember one of the first things you said is scaling. So do you, Seema talked a little bit about the strategic focus at the end of the, we have to align what we're trying to do, who are the leaders, where's the accountability, what are we doing, and where can we make the most impact to align that, which I think we would all agree. And then what would be the next step to moving it forward, Joe?
Yeah, I mean, I think Seema has really said it well. It starts at the top, within organizations that we've seen that are really successful. It starts at the top with the executive and the board, and them making kind of a clear assessment of risks and understanding opportunities from a business case standpoint. And really kind of benchmarking other organizations. We know that it's helpful to study what other C-suites and other boards are doing, what other health systems are doing. That seems to stimulate a lot of action. And it's not just peer pressure, but it's a question of sort of building confidence that action can be taken in a meaningful way. I mean, from the standpoint of scaling, you know, if we zoom out and sort of say, what are we trying to orchestrate at a national level? I think we just have to acknowledge that we operate in a health system that is very different than a lot of the health systems in the world. So, you know, when I think of sort of great success stories from around the globe, I think of the National Health Service in the UK. They've done a fabulous job at mobilizing their entire system, at getting all of their trust into action on addressing the impacts of climate change and anticipating the impacts of climate change, and, you know, reducing emissions in really thoughtful and powerful ways. But we don't quite have that luxury here because, you know, the vast majority of our healthcare provision comes from the private sector. We do have federal providers that I mentioned, that, you know, the Veterans Administration and the Military Health System and the Indian Health Service and a few others. But by and large, you know, the care is coming from lots of different organizations at lots of different levels of readiness and experience. So a big academic health system with, you know, lots of resources is going to be in a very different position than a small rural hospital or community facility. And so what we need to do is we kind of need to understand I don't think there's a generic starting point. I think, you know, the question is, what's the starting point for different facilities and different provider types at different levels of readiness, and where can they begin? What's kind of the low-hanging fruit for action for each of them? So that's part of what we're trying to do right now, is really kind of understand what does initial action look like on both kind of preparedness and resilience and decarbonization. You know, and so some of these toolkits that I mentioned it's kind of about that. It's about trying to find the starting point for organizations at different stages of readiness, really distill the best practices, and then, you know, support organizations in substantial ways on actually introducing those. And again, that's not just technical assistance, but it's finding financing opportunities. So as Seema said, you know, if you make that initial investment, with some help, you begin to actually see the savings and, you know, see the long-term efficiencies to the organization.
What's an example of a less mature organization you would recommend taking their first step, you know, as a use case? You kind of you alluded to it a little bit, whether it's in decarbonization or something else. Tangibly, what would that look like?
I mean, I think it starts with sort of assessment of risk. So for a lot of these organizations, you know, if we think of a community health center or a rural hospital, you know, or a safety net facility, they're kind of at the crux of care in these communities that we know are the most vulnerable and are being hit the hardest by either catastrophic climate events or kind of the chronic impacts of climate change. And so for them, I think it's a question of assessing where the greatest risk lies and thinking about what are the anticipatory actions that they can take for the most vulnerable parts of their communities. We have a tool which is called the Sustainable Healthcare Facilities Resilience Initiative Toolkit. It's a mouthful. We sometimes call it the Scruffy. And it's a tool we're actually working on updating right now, but it's for exactly that purpose, you know, so that organizations can just start to understand, well, these are the 3 or 4 likeliest things to happen that could either disrupt our operations or cause great harm to the people that we serve. So let's get ahead of that and develop anticipatory plans there. I think that's how we're thinking about starting.
No, that's very helpful. And actually, we have a question from one of our audience members as well, Lancel, and I apologize if I mispronounced your first name. The question is, I wonder if the panel has any sector-specific advice around evaluating various standards and certifications, SASB, B Corp, etc., and how to know which best aligns with your organization or the ROI of aligning with one versus the other. So basically any insight on evaluating different standards and certifications.
I mean, I'll
sure.
just offer, you know, oh, please.
Please do.
Yes,
Go ahead.
please.
Maybe I'll just quickly jump in because this is something that we do a lot of. So in fact, we're collaborating with GRI. We in the close discussions with B Corp as well, and we look at those standard certification from two angles. First of all, we're just making sure that we are in line, that we are not lagging behind, and in some dimensions where we can be ahead of this. So monitoring more how our comprehensive program, and that we are also able to join those standards where we can, to join the different ranking, etc., and collaborate on creating those. And then basically the fact of joining also matters for investors, for wider range of stakeholders, but for the company itself, for us, we usually manage our basically framework, of course. So we are joining science-based targets, for example, and we are collaborating with such organization on the specific topics. Yeah, so we wouldn't evaluate them one versus the other, but we would rather see to keep them monitoring and aligning, and also discussing with them how to bring those standards and frameworks forward. Yeah.
Thanks, Joe. I think you had a comment as well.
Yeah, I was just going to quickly say, you know, in our position in the government, you know, we're not in a position to sort of endorse a specific framework or a specific approach, but I will say that in introducing this pledge initiative, you know, one of the things that was really important to us was to make sure it was aligned with and could basically absorb the work of organizations working on any of these initiatives or working within any of these frameworks. Because I think our view is, you know, the starting point is to have goals and have objectives. And as long as they're kind of generally aligned with what we're trying to accomplish in this administration, you know, it's a positive thing. And that we co-chair the National Academy of Medicine's Action Collaborative on Decarbonizing the U.S. Health Sector, which is a public-private collaborative, and it brings together stakeholders. And I think what we're finding in that group is that, you know, the important thing is having goals and objectives and being transparent about measuring progress against those. And I think that's really kind of what the future needs to be for the sector. It's not just a question of kind of exposing people and ranking people and accountability, although I suppose accountability is part of it, but it's learning too, you know, so how can we learn from the bright spots and performers that are getting results quickly and study one another in that way. And I think that's the type of learning environment we want to create.
If I could add to that, you know, I think there's been a recent rise of ESG and, you know, this term that relates to measuring all of this. I think that the healthcare industry has been doing a lot of what's considered ESG, and, you know, thinking of the ratings related to, for instance, GRI and SASB that were mentioned. And, you know, I think I'm gonna agree with the colleagues on the line here of, I think it's a little less important which framework you use to a certain degree, and more important that you are looking at all of the different elements in those frameworks, whether it's GRI or SASB, and you're measuring and you're benchmarking and you're setting targets and you're improving in those areas. So I think that's really the important exercise.
You know, related to that question or that response, actually, I think it's a theme that everyone mentioned. One of the audience members asked, for many years, financial credit industries have tried to resolve matters related to consumer access and equity. What can the healthcare industry learn and apply in use cases? And in my mind, there's multiple differences between the two industries, but one is the application and use of technology and that technology infrastructure. I would love to kind of hear from our panelists, you know, do you agree? And then what is the role of technology, as kind of the last comment that Seema made around, you measure what's important, and how do we kind of develop this framework of PDSA cycles of actually having improvement in certain metrics? I think you're on mute, Seema.
Sorry, thanks. I'll start with a general theme, and I'm sorry, I think the automatic lights went off here, so a little bit darker here, but I'll start with the general theme that I do think there's a lot for the healthcare industry to learn from the private sector, from other sectors when it just broadly comes to environmental sustainability and stewardship. I think a lot of work has been happening in those sectors, and I think that a lot of people have not put the focus or attention or even the consideration that the healthcare industry has a broad impact there. So just broadly, I think there's a lot to learn. And then in terms of the role of technology, that is another area where I feel like we have been behind. I think that COVID accelerated the adoption of telemedicine, and, you know, there are other technologies out there that can really drive action. But I will also still caveat that with, it's not just a technology issue. When we look at the solutions for climate change, there are a variety of technologies out there to help us get there right now. It's around not only policy, it's politics, it's culture, it's talking about these issues. You know, there's so much data that shows that so many more people are worried about climate change. You know, I think it's somewhere around 80%, yet they have this perception that a much smaller grouping is worried, and it's because not enough people are talking about it. So, you know, if there's one thing that everybody on this call can leave with and do independent of their organization, is to go talk to somebody, talk to your neighbor, talk to your organization, and make it real. And leverage, you know, then we can start leveraging the technology and the shared learnings from other sectors as well.
I would just say, you know, here to that, you know, I mean, one of the words we use a lot in our team is latency. There's so much latent energy and concern and will around addressing climate-related challenges, and that exists in the workforce especially. And I think, you know, organizations that are having success are tapping into that energy, and those workforces are making it clear to leadership too that, you know, they want to take meaningful action in these areas. I mentioned, I think at the start, you know, so I've kind of worked on large-scale change and movements, and there are lots of things that successful movements have in common. You know, one is they have really clear aims. You know, they limit fear and you know, try to sort of create an encouraging learning environment. But you know, another really critical piece is that they are kind of exemplars of teamwork. You know, and there's just great transparency and collaboration, and I think that's what we need in the U.S. especially. Again, it's easier in some ways if you are in a national health system to mobilize action and activity, harder in others, but easier in many ways. So, you know, we have to say, in the same way at the start of the pandemic, people came together selflessly and shared everything that they knew. You know, we've got to do the same thing here with climate to accelerate the learning. And you know, another just last thought about sources of energy and how to stimulate activity is living in and being connected to the community. And I know KP does that in such an exemplary way, but if you really are seeing what's happening, and we have, you know, the experience of this in the government on a daily basis, if you hear about the suffering that's happening in the community, if you hear about the experience of living through, you know, an extreme heat wave or fires or flooding, from the families and the people that are experiencing it, and the health centers that are experiencing it, and the rural hospitals that are experiencing it, it's a huge source of energy, and it makes very vivid just how serious the challenges are.
Thanks. Olesya, any additional thoughts or final thoughts you'd like to share as well?
Sure. Yeah, great points have been mentioned. And also as a source of energy, I would like to add to this. So also work in the community, and we encourage volunteering. And that also helps to drive, to spark the ideas, to increase engagement, to bring more energy also to employees and colleagues on the subject. Another part I would like to add is also like, I think Ankoor, you mentioned earlier, there is also overwhelming, the topic is overwhelming, right? And then so first you build the why, and then the second is also good to get the grip on the scope of what, something, the low-hanging fruit, something which is in our own scope. And therefore, Philips, since we are manufacturing also medical equipment, large medical equipment, therefore, we looked into this as an example. We look into circularity. As a circularity, actually, our materials generate about 40% of global footprint. And circular practices are helping to basically to reduce it, but circular practices are required to be established in a collaboration. At the same time, because we are servicing our equipment, and therefore we can follow the life cycle. And then as an example, the servicing organization, the all parts that we have also in the United States, and they're servicing about 32,000 pieces of parts of equipment, and they establish their circular practices. This is something that we can manage within our own scope and yet see the contribution. In addition, also to partnering on some other initiatives or broader across the value chain.
Thank you. From what I'm hearing, just the themes I'm hearing is, if the audience could come away with one action item from this conversation, is to talk about health equity and climate change and environmental sustainability within your organization, but to your neighbors, within your community. And then how are we know the why, and the what, it's overwhelming, but we could just get started. Because as Joe mentioned, a lot of research shows as well, the workforce is engaged, people are engaged and are looking to their organizations for action. It's going to be a must-have very soon as well. I want to thank so much our amazing panelists as well, Seema, Joe, and Olesya. And thank you all for the audience for joining. I'll actually pass it over to Jen to see if we could close this out. But thank you all.
Ankoor, this was fabulous and beautifully moderated. Really wonderful. Thank you so much. It's been great to have you today. And I think Ankoor's made some great points about what we can take away from today. So thank you so much. We will send the links out, any link to the webinar today to everybody within the next 24 hours. Thank you for joining us today, and to our wonderful moderator and speakers today. We greatly appreciate it, and have a wonderful afternoon, everyone.
Thank you so much, guys.
Bye.